welcome back. Another one of our social media questions that we answer here on the channel. So this gentleman has very interesting pictures, and what I like about doing these social media things is that you get things you don't normally see or talk about, so it just keeps the content fresh. So this gentleman asked about his options for a birthmark that he had. So I don't know if you can see in the picture here, there's this darker colored birthmark, in contrast to his fair skin in front. And what he describes is that this area used to be covered by hair, but now the hair has fallen out. So obviously I'm not seeing him here in person. I would love to get my hands on his scalp and my loupes and my microscope to see really what's going on here. At face value, looking what he's saying and looking at the picture, there's only this one picture, it looks to me like it's a regular birthmark, a melanocytic birthmark. Some of them can be dangerous, some of them are not. So right away, there's some differentiation here that needs to be made. So I'm assuming he went to a dermatologist and maybe had a biopsy with this thing done. Because some birthmarks, you have to actually remove them because they can become cancers in the future. So I'm assuming this is not that, So, and also I'm assuming that he had some male pattern baldness, as he doesn't say how old he is right now, but he started thinning out at age 17, 18. So this looks to be like on the corner of the hairline, upper in the forehead. So this could be just male pattern hair loss that's now affecting that area. And because it has the birthmark, now it uncovered the area that was underneath. But again, I'm assuming a bunch of things here, so don't quote me on that. If that's what it is, if it's male pattern baldness, a hairline recession, yeah, that can be transplanted. We would treat them with medication to decrease the progression of the hair loss. And most of this birthmark can be covered with hair, so that it will be back to the way it was before. I don't know that we would cover the whole thing because it looks like it comes pretty far forward here, but it could be covered 90% of it, So again, that's the importance of coming in for a consultation with somebody that understands hair loss and skin problems. It is an unusual thing, but I've had patients with birthmarks many times before, and they are not a problem to transplant over it as long as they are the types that can be treated. So assuming all that, the hair should grow very nicely, it should look good, and we would treat it just like a normal transplant, trying to cover that area as much as we can. So that's the short answer to that. So interesting question.
So doctor, again, we don't have all the specs for this patient, right. But assuming, which is kind of a risky, right. Maybe he was trying to say it's like, well, maybe the hair just fall because of the birthmark.
Right.
If I put new hair there, would it fall as well?
Yeah, that's a great question, and that's what we need to figure out. So first of all, what kind of birthmark it is, right? If you look, there's many different types of birthmarks, from blood vessels that cause birthmarks to different cell types that cause the birthmark. Like I said, some of them need to be actually completely removed because they're highly likely to become a cancer in the future. So again, I'm assuming this is not, because says in the question that at the age 17 or 18, the hair started to fall out. So I'm assuming he's at least in his 20s or older, right? So probably that birthmark had been looked at by somebody and it was told, okay, no worries, this is nothing. So if that's what it is, the skin is healthy, there's no problem, the hair should grow. And the birthmark should not have been the cause of the hair loss. I think the cause of the hair loss was either male pattern hair loss or any other type of hair loss, but nothing related to the birthmark itself.
Okay.
There are some birthmarks. You see people all the time. They have a little birthmark on their face, and actually there's extra thick hair in that area. So you see that all the time. Obviously not his case, but that's why. Birthmarks are not all equal. They are different, and it needs to be diagnosed first. So, but yeah, assuming all these things are true, right? That we are assuming here, it should be successful, and we should be able to transplant it successfully.
So should this gentleman go, if he is to go to a clinic that doesn't have a physician who provides a recommendation, and let's say the educator or consultant recommends a procedure, and it's not thoroughly diagnosed that this is a potential cancer-causing birthmark, what can happen to the grafts that are transplanted into that? The
grafts will probably grow, but then at that point, you're really putting the patient's life at risk, right? Because if you don't treat this, and it should have been treated, then you're just masking it. And it's going to become even harder to follow that up because now you're covering and you're hiding it, right? The transplant should not make anything worse.
Okay.
But it's just not a good thing to do things before you have a final diagnosis on
So
any area. That's why, in our consultations, a lot of times I'll send the patient for a biopsy first and then come back, and then, we'll try to really know where we're stepping, in order to, before we do anything. But
so it could almost be a potential life-causing issue if a doctor does not actually see this person.
Right. I mean, if he came to me for the original consultation with this very limited history here, I would say, okay, first of all, let's get a biopsy. Let's see what kind of birthmark we're dealing with, right? So get a biopsy, then it's just a regular melanocytic blood birthmark that people have all over the body sometimes. It just happens to be in the scalp. Fine, we'll go and then at that point, actually the birthmark will probably help us a little bit because it'll act like a natural pigmentation behind the transplant, so it'll make it look a little thicker. So, again, if you're open to things and you've done this for a while, you can get these ancillary benefits without even thinking about it. But it all has reference to the diagnosis. That's very important. Yeah.
Okay.
That's why you should see a physician or someone who understands the medical side of hair loss for your consultation. You should not rely on the recommendation that was done by someone who's not a physician, because they don't know. They didn't go to medical school. They didn't, so I'm not saying that they don't know what they're doing, but they look at everybody as a transplant candidate, and sometimes it's not the case.